More than a quarter of Minnesota high school students admit to vaping in the last month.
Recent cases of a severe, sometimes a deadly lung disease might inspire users to quit, but it is not easy. Tonight, WCCO's Liz Collin explains why putting down the vape can be harder than kicking a cigarette habit.
I knew it was bad. I never thought I would get addicted.
It's the thought many addicts later admit to. Mitch Byers started smoking cigarettes when he moved away to college.
The appeal was everybody else was kind of doing it, so I kind of just started smoking to blend in with the crowd.
But he was surprised how little time it took to prove his initial thought wrong.
It did not take very long for me to go from like maybe 1 or 2 cigarettes a week to a pack a day.
Byers replaced his pack-a-day habit after college with a more discreet device he hoped would wean him off nicotine altogether.
You really thought vaping was better for you?
Yeah, than compared to cigarettes and other alternatives.
Soon he spent as much as $75 a week on vape juice and would take a hit at least every few minutes.
From the time you woke up in the morning to when you went to bed at night?
Yes.
Until last year.
It was in my chest. My whole left side of my body kind of started to ache.
When the pain set in,
I thought I was having a heart attack.
That would eventually put the then 24-year-old in the emergency room.
I had told them that I had been vaping quite a bit, and they said that could very well be it.
The problems are pretty concerning. I mean, some of these individuals have lung injuries that can be permanent.
As the medical director for Hazelden Betty Ford's Youth Services, Dr. Joseph Lee has witnessed how much harder kicking the vape habit can be. The difference is the nicotine content. The amount in one vape cartridge can equal the nicotine in 1 or even 2 packs of cigarettes. Doctors say inhaling more deeply and more often only adds to the danger.
Kids who used to need like a lower level of a nicotine patch to get through cravings for a day might need a much higher level and they don't know it. So it's no surprise that people are having a hard time stopping.
So what's the best way to quit vaping? Dr. Lee says to never try to do it alone. He suggests becoming part of a treatment program. Gum and lozenges can partially work, but he says only when coupled with a prescription that can help with nicotine cravings.
Vaping or smoking anything and putting it into your lungs is simply not natural.
Dr. Lee says there is not yet much research on the long-term effects of vaping. In some cases, it can take up to a year for lungs to clear.
I haven't had chest pain since.
Byers stopped vaping the day he went to the ER. A year later, he's recovering with the help of therapy and lozenges. A scary wake-up call he hopes will keep others out of the hospital.
It's not worth it.
Liz Collin, WCCO 4 News.
Dr. Lee says most injuries and deaths from vaping have been blamed on the counterfeit cartridge business, especially those containing marijuana. You can find resources to help quit vaping on WCCO.com.